Hey, you're listening to Rising into Mindful Motherhood. I'm your host, Dr. Katie Wood. I'm a barefoot mama bear, pharmacist, integrative fertility health coach, and lover of all things nature and animals. I'm on a mission to have intentional conversations about the good, the bad, and the ugly when it comes to fertility, pregnancy, postpartum, and beyond. My mindful guests and I will be talking about struggles, wins, natural wellness, and how we grow and transform as we enter motherhood. My background in healthcare has shown me how broken our medical system is. My own struggles to become pregnant has shown the lack of support for mamas to be, the lack of guidance for women to have a nourishing and vibrant pregnancy, the isolation, mom guilt, and all the things we hold after bringing baby earthside. I want this platform to be a place where women can feel connected, safe, and supported to share and hear their stories. A place to use our voice to discuss and advocate about what we need and deserve as mothers. So let's dive in, shall we? Hello and welcome to Rising into Mindful Motherhood. I am so excited for our conversation today. I'll be chatting with Dr. Marina Buksov, who is a functional medicine pharmacist, a health coach, and an herbal educator. Marina guides practitioners to rediscover their passion for medicine by expanding their mind and clinical skills to include natural, holistic, alternative, and herbal medicine. She'll be sharing with us today about how herbs can be used in preparation for pregnancy, during pregnancy, and postpartum. So I'm super excited to dive into all of this. So welcome, Marina. I'm so happy to have you here.
Thanks so much for having me, Katie.
Awesome. So I would love to just learn how you got to where you are today. So obviously we're both pharmacists. I know that when I was going into pharmacy school, I would have never have guessed that I'm doing what I'm doing now. So why don't you just tell us about your journey and what has inspired you to take this path after, doing something like pharmacy?
Yes, so my path was definitely not linear. I started out just going to a straight PharmD program, 0 through 6, just randomly applying and just saying like, well, this will be kind of my backup in case I decide to do this, because I guess I was scared into like saying that or thinking that you have to decide this from the beginning because it's a 6-year program. So if you're going to commit, it's a long time. It's 2 more years and you're a doctor. So I mean, and we are doctors of pharmacy but not MDs. And so I kind of just never really thought about it too much in high school, but my parents had told me, to consider it. My parents are chemists and biologists. So they're like, well, this is a profession that's kind of like ours, but it's a lot more lucrative. So maybe you can consider that. And, I loved chemistry. I loved physics. I loved math. Didn't love biology too much, but I thought that, this is pretty interesting. So let me just apply. And there are only 2 schools in my immediate area. So it was kind of an easy decision. And then I went with the one that had the nicer campus and the better scholarship. So that's kind of my thinking process was like, well, if I don't like it, I could always change to something else, but it'll be hard to transition into it if I decide to later. So just went along and I went to St. John's University and graduated, ended up sticking all the 6 years and loving it. I loved the program, the education, everything that I learned was fascinating. And I was actually introduced to complementary and alternative medicine as an elective class. And then we also had a nutraceutical class. And then we had a school club dedicated to complementary and alternative medicine. So it was kind of like on the radar from pharmacy school, but of course not the focus. So once I started actually working and I took a job in the retail setting, I realized that, we're not focusing enough on non-pharmacological consultations, right, and counseling points. we're only really focused on the drug, and we barely even have time to counsel, period, or, on anything prescription or over-the-counter related. So that didn't really sit well with me. And I realized that, the more we focus on prevention and self-care and nutrition and the non-pharmacological therapy, the better we are. And my goal was always to get people to as little medications that they need as possible, and really just have a resilient body and vitality and life force energy. And I didn't really go into my profession thinking that, but I think just being on that dispensing end of it and seeing how many people depend on these pharmaceuticals just made me realize, like, this is a burden on our organs of elimination and detoxification, right? And this is like, literally, it takes so much mental energy to remember to take those drugs, and then for your body to absorb them and break them down. And then we don't really know the interactions that go on because they haven't been studied in such mass quantities that people are taking them. And everybody's different. Everybody's physiology is a bit different. So it's kind of like, you think, theoretically we know so much, but it's honestly like the Wild West when it comes to what actually happens, in practice. So I got curious to explore, what could I do with my pharmacy education, like having this background knowledge, but more so focusing on the holistic approach. And also, some of my retail settings specialize in herbal medicine as the over-the-counter, supplement selection that they sold. And they had trained clerks that spoke about it. So I was inspired by those pharmacies too, just seeing that, the pharmacy is kind of a place of healing, and you don't only have to focus on pharmaceuticals. You could also counsel people, and you could also specialize in herbs and nutraceuticals and supplements as well.
Mm-hmm. Yeah, I love that. And I feel like you and I are on the same page there, as being behind the counter, having that experience really, really opens your eyes, and it opened my eyes too, to, wow, like this is all we're offering them for the most part, is take your statin, take your insulin, and doing medication therapy management, or MTMs. That's really that really kind of hammered that in for me, as I'm just calling these people to make sure that they're taking these medications that are just kind of a band-aid to the problems that they have. And a lot of times people, they don't even know what they're taking. They don't know why they're taking it. They're just taking it because their doctor told them to. So I totally agree with you on that. And I think a lot of pharmacists are really coming to that realization too.
Yeah, I definitely see many of us being very mindful, about self-care, just because we see that it's not the ideal scenario that you want to be on all of these life-saving drugs, which they are, of course, miraculous cures in some cases, or something that you would definitely need in an acute care situation. But how can we make our self-care, and daily rituals in a way that what we're doing in life is our medicine, instead of treating our bodies super badly, and not even paying attention to it, and not even being grateful for it, taking it for granted, and then needing to be on all of this support.
Yeah, absolutely. So you worked in retail, then are you still in retail now?
No, I was actually transitioned out of it right before my second baby, which was this February. I transitioned, and she was born in March.
Awesome. Awesome. That's amazing. So now are you mainly focusing on, I know you have a course, I believe, for
Yes.
herbal practices. So is your main focus on educating practitioners? Do you also support clients one-on-one? What does that look like?
Yes, so my main focus right now is the education and mentorship platform that I built for other practitioners and professionals. So I do work with a lot of pharmacists that are also looking to get into the more holistic wellness and herbal consults with their own clients. And so I'm using my experience building that out on the side over a number of years, pretty much the past decade between educating myself first in all of the holistic modalities and herbalism and coaching, and then in actually how to run and market and sell your services. So doing a lot of business mentorship. And finally, I've kind of figured out a method that I can help others achieve this in a lot less time and energy than what it took me, and also in a sustainable way, because doing, freelance things is not always 100% sustainable. So that is what I really help people figure out. And also, just utilize whatever they have going on for them, whether it's a pharmacy background, whether it's a network, whether they're a pharmacy owner, and integrate or offer completely new services or products for their clients.
I really love that, because I think a pharmacist learning from another pharmacist about these alternative therapies has a lot of benefit to it than maybe learning from someone who doesn't have the pharmacy background, because you have that pharmacist mind that we have, and you're able to combine the two, like the Western medicine and the alternative medicine together. So I'm sure that makes it a lot more easier to kind of digest. I'm just thinking of myself as like a pharmacist going through this. So I think that that's really important. And I know I heard from a fellow colleague who just finished your course over the summer, and she said it was so amazing. And it's definitely something I'm interested in learning more about. She did say that there was like a women's health or reproductive section. Is that something you could kind of tell us a little bit more about?
Yeah, absolutely. So I have been definitely interested and working in the past with clients, and I still do actually take clients. I am part of a functional medicine team where I do see one-on-one clients. I don't like to say patients, I just like to say clients, just because it doesn't reinforce the idea that, if you're a patient, you're sick. And so I specialize in gut health and in women's health, because that is something that I struggled a lot with personally. Hormones are a part of that picture, of course. So I started the whole education side of my business was I just started running workshops. So it started out with a local herb shop where I used to work and intern. And I would just do live in-person events. And then I moved to online. And of course, with the pandemic, that was really beneficial. And it could reach a lot more people. So, when I was creating the curriculum for my main course, I just used some of my previous workshops. And so I built out my women's health lectures based on what I've done in the past on workshops. So kind of recycling my content. And I do think, like you said, as pharmacists, we tend to compartmentalize and rationalize, and are also, frankly, taught to be skeptical of anything that's not in the mainstream guidelines, right? And we have to follow them, and we can't stray away at all. So understanding what the herbal perspective is and layering that into my pre-existing knowledge. Of course, I think learning anything from anyone, there's an inherent bias where, somebody's already interpreting the information and then teaching it to you in their own lens. So of course, that is a possibility and something that we just have to account for. But I just teach from the traditions of my teachers, what they have passed on through their lineages. And I also direct people back to the source of the information, which of course we like, evidence-based textbooks and other, written sources of information, tertiary, whatever it may be. I always link back to that, just so if you want to learn it on your own, you can certainly go and dive really head deep into this stuff. But I try to really condense it into a way that our brain understands and kind of layers on top of our foundations. So for the women's portion, I start with how to support fertility, actually. So understanding your cycle is number one. So we go through, what does it mean to have a cycle and the whole hormone cascade and the whole axis with the hypothalamus. and everything that happens, and then how to support that with diet, lifestyle, and herbs, right? And really understanding, what are oral contraceptives doing to this cycle. And it's amazing how many times you can learn the cycle and still find out, new information each time.
Yeah.
Because it's kind of esoteric. It's also physiological. There's also tradition and myths associated with it. So I just find it amazing that more women, girls who start menstruating are just not taught these basics and then are just put on birth control for XYZ reason. Sometimes, of course, there's a reason outside of wanting to prevent pregnancy. There's a reason that is medical, or, too much bleeding, loss of blood, anemia, et cetera, other things like, estrogen dominant conditions. So I understand the reason, but there's just not enough education about what else do we do? What does the cycle do? What are the pros and cons of starting a medication like this? People are on it for decades and they don't understand their body or their cycle. So that's the first thing that we go over. The second thing is how to support fertility now that we know how to the cycle kind of works and what the job of all of our cascades are, and understanding that, our environment plays a huge role, and that's both like external and then internal, our emotional environment and stress and perceived stress and how that all interacts, and then diet and lifestyle and herbs. So how can we really support our hormones to communicate to each other in a way that it's safe to go on and create another human being, and that we have enough nutrients and resources to support those processes? Then we also talk a little bit, about the postpartum period, and then we go into supporting just, women through their menopausal and perimenopausal years as well, because there it goes another whole hormone communication cascade. So, just really understanding like that the body is intelligent and wise, and what we need to do is really just get out of its own ability to self-regulate and just give it enough nutrients and resources and ways that it can, self-regulate and detox and have everything it needs for the processes that go on.
Mm-hmm. That sounds amazing and beautiful and so needed for, especially like you said, young girls. I remember 5th grade, they had that class with us, but I don't, think that they really get into those details. And even when we're older and you have like the sex education classes, I love that you start with the basics and the foundations of understanding what your cycle is and what that looks like. Like there's so, like you said, I always feel like I'm learning something new. There's just so many cascades and little things that happen. And that's just really the things that we know. I'm sure there's so many other things happening behind the scenes, but that's how I start my group coaching membership as well, is giving them a foundation and a background of what a cycle looks like, because without a healthy and a balanced cycle, there is no fertility. So I love that you start with that. Now, I'd love to hear a little bit more about herbs. What are some of your go-to herbs that you recommend for fertility? And then, of course, if there's some that are good for certain conditions and may not be for everyone, I'm sure there's some that you should only use under a practitioner's guidance who is well-versed in herbalism. But then maybe there's some that are pretty safe for the general public.
Yeah, absolutely. I mean, medical disclaimer here is that this is not a medical advice or information recommendation that I'll be talking about right now. But generally speaking, yes, I would always advise still double checking with your herbalist, pharmacist, doctor about starting anything new, including herbs. But the problem is not many people are well versed unless they say that they're an herbalist. A lot of people, like I said, in the allopathic model will shy away and just say that, number one, there's not enough information or evidence. Number two, it might be toxic or interfere with your medications. So that is kind of just the general thing that we're taught to say, and we're just taught to distrust, like I said. And the problem is nobody actually goes a step above that to actually research what you're coming, to your practitioner with, what questions you have, and they'll most likely just give you that blanket of probably don't do that, right? So that is the problem, and I found that in my own healthcare, that if I'm the herbal expert, I know what I'm doing and putting in my body, but I find myself being shy to tell that information to my medical providers because they wouldn't understand or approve anyway. So that's part of the mission here, is to actually recreate that trust. So the self-trust that you can take care of yourself, and then the trust with your providers that you can actually have an open and honest two-way relationship. And that's a big problem that I see. But for the most part, if you have the general foundational knowledge, or if you are under the guidance of an herbalist, then you can figure out, a pretty safe way to navigate trying to incorporate herbs. And we are purists in that we love to incorporate herbs in their most natural and most bioavailable form, which to us means it's the whole plant. It's the crude plant. It's not an extract. It's not an essential oil. It's literally, in its most natural form, whether it's a powder of the herb, it's a tea that you brew, or it's a tincture, and a lot of tinctures are alcohol-based, and that is to promote the extraction of certain constituents that we would like. And it's also very convenient, and it's a much more concentrated and potent form of the herb. And then lastly, if the person will not take it in any of those forms, not put it in their food or smoothie, or just make it part of their routine, then we'll go to, tablets and syrups and capsules and things like that. So that's just a general disclaimer. And as far as supporting fertility with herbs, so number one thing that we want to do is, like I mentioned, make sure your body has just enough nutrients to function, to do its daily activities that it has to do. And there's just not enough microelements, and trace minerals and vitamins. Unfortunately, in our day-to-day lifestyle and diet, the SAD, right, standard American diet, certainly doesn't provide enough. And if you're consuming processed junk food on top of that, then you're depleting all of those nutrients that are going into actually trying to metabolize and detoxify what you're putting in. So that means that you need to account for everything, unfortunately, that we're exposed to willingly, or knowingly or unknowingly in our environment or in our food. And accounting that we need more nutrients than we think. And unfortunately, they don't always come from our food, plus some of our foods deplete them. So therefore, we need to try to eat clean. We need to try to de-stress or manage our stress. We need to sleep well to make sure, our body doesn't feel like it's under stress and it's coping with all of these things. And then we need to try to clean up our diet and our water, make sure that we are filtering our water. We're not using plastics for containers for food and water and drinking. Plastic water bottles drive me crazy. And then the next layer is, how do we eat nutrient dense foods, right? And just cut out some of the junk and processed stuff. And this is where plants come in. So just using tons of spices. Spices are generally recognized as safe. So, if it's a spice, you can probably safely consume that, and that could be your medicine. Seaweed is, supportive for iodine for your thyroid, and proteins, making sure you're having high quality proteins. Try to shop organic to decrease your pesticides. Medicinal mushrooms are amazing, and you can pretty much start out with any medicinal mushroom. They're generally safe. I would probably just say, if you are pregnant or lactating, there will probably be some online source saying that it's not safe. So, take this with a grain of salt, and again, consult with your own practitioner. But for the most part, medicinal mushrooms are considered to be super safe and really a superfood. Berries, right? Whether it's like an herbal berry or actual berries that we are used to eating, like blueberries, blackberries. They are amazing superfoods. Vitamin C rich foods, vitamin B, like the ton of B vitamins, iron rich foods. So magnesium, vitamin D, things that, our foods are lacking, that you might want to get from herbs or supplements. So from my nutrient dense powerhouses, I love nettles and alfalfa. Those are two that I try to get in. Moringa is another great source. And then the second thing that we want is to allow our body to detoxify, right? And optimize the detoxification, whether it's from xenoestrogens or, your hormones are out of whack from the androgen perspective. So there are several herbs that we can use to help that communication happen. And one that I really love that helps balance out your progesterone, which tends to be lower in females that are having infertility in relation to their estrogen, right? So it's always a ratio. So I love chaste tree berry, or Vitex is the other name for it. And that is like my number one go-to. And then to support our liver detoxification processes, I love milk thistle, or blessed thistle is another one. And these are all, gentle, supportive herbs. Dandelion root is another one. And one plant that has been historically used even throughout pregnancy and is known to be safe is raspberry leaf. So this actually nourishes your uterus and makes sure that the smooth muscle walls of the uterus are, firm and juicy and conducive to pregnancy and also labor, so that it contracts in a supportive way. And obviously, when you're in labor, you want to contract effectively. You don't want to just have contractions and then that's not helping your baby move down. So you want a little bit of strength to that uterine wall tissue and muscular layer. And that's what raspberry leaf is known for. It's one of the classes of herbs that we call Partus preparator. And other herbs in this category are typically used by midwives to actually stimulate labor. So general disclaimer is you should not be using these on your own, except for raspberry leaf, which has been shown to be safe. Some sources will say avoid it during first trimester. I've typically drank it before, during, and after pregnancy, and that's what I consider safe. But if you want to be, very technical, you might want to start it in your second trimester. But it's also a great postpartum herb to help tone that muscle, back to its normal size and shape after labor.
Wow, such a wealth of knowledge. Thank you so much for sharing all of that information, and also just reminding everyone of the basics of supporting our overall health and well-being. So all of those things were amazing. And I also used the red raspberry leaf when I was pregnant. I did wait until later on in the pregnancy, because I do remember reading about avoiding it in the first trimester. And that's really when I think when you do try to do your own research by yourself without a professional, you can get that type of information online where it just says that there's either not enough to say that it's safe and whatnot. But I did end up having a wonderful midwife once I switched halfway, and she was very knowledgeable about all of those things. So she was very helpful in terms of my pregnancy journey. So that's great. Thank you for that tip. And I know you mentioned that you have a wonderful freebie for the audience, the Natural Medicine Makeover Guide. Would you be able to tell us just a little bit about that?
Yeah, I created it just thinking like, what would I want to know about herbs or natural, safer, cleaner products when it comes to reorganizing my medicine cabinet? Because obviously as a pharmacist, I know the go-to remedies for everything, but it's a pharmaceutical. So if I want to clean up my first aid kit and, my go-to medications for if somebody's, sick or stomach ache or headache or whatever it may be, right? How do I make those options more holistic and more natural? And what can I do to replace some of these pharmaceuticals that I'm trying to downsize, right? And that's kind of what I came up with. Like I categorized it by all the different categories. And this is what I use, to recommend to my family and my friends when they ask me. They are always asking me for stuff. Or, when I was in the retail, I would tell people, okay, well, this is, the pharmaceutical option. This is the holistic option so that you have both.
Amazing. I cannot wait to check it out for myself and see what you have in there, because I definitely like to have more natural options available in our household. So where can the audience learn more about you and connect with you? I'm sure there may even be practitioners that are listening that may want to sign up for your program. So where can they learn more?
So you can go to my website. It's drmarinabuksov.com, and you can connect with me there. I'm also under that name, Dr. Marina Buksov, on all social media, pretty active on Instagram, and I try to share there pretty regularly. So you can connect with me there and drop me a note, also on LinkedIn, Facebook.
Amazing. Thank you so much for sharing your gifts and your wisdom with us today, Marina. I really, really enjoyed it.
My pleasure. Thank you so much for having me.
Of course. Thank you for tuning in today. Make sure you follow and leave a rating so we can connect with more mamas, and I will see you on the next episode.